Rhabdomyolysis. The most common symptoms are discolored urine and weakness of the muscles. There are also the triad symptoms, which are myalgia, which is the pain in the muscles, weakness, and myoglobinuria, which is the presence of myoglobin in the urine. That causes the urine to be discolored. However, these symptoms do not always show, and it happens in less than 10% of the people who have rhabdomyolysis. Discolored urine is more common with it happening in more than 50% of the people. The diagnosis, there can be lab tests for increased CK, which is around 5 times higher than normal levels, and a test for myoglobin in the blood. Now, along with these lab tests, doctors can do a dip test in the urine to see if there is myoglobin in the urine. The earliest a doctor can detect rhabdomyolysis is 3 to 5 days after a physical injury. If this is not diagnosed, the levels of myoglobin and CK will continue to increase. Then the excess of myoglobin can start to cause kidney damage and can be permanent. If left untreated, this can result in death. Some risk factors are crush injuries, overexertion, alcohol abuse, some genetic disorders, certain medicine, and illicit drugs. When a crush injury occurs, there's a release of neurotic muscle into the bloodstream after compression is released. Overexertion would be not properly trained for physical activity. A genetic disorder would be McArdle's disease. Some medicines like statins that can help lower cholesterol, and illicit drugs like cocaine or heroin. So in the normal physiology of the muscles would be the ion channels of the sarcolemma have a lower intracellular of sodium and calcium and a higher concentration in the muscle fibers of potassium. When the muscle depolarizes, calcium is released and binds with tropion, which causes the protein shape. Then ADP attaches to myosin to become stretched and binds with actin. Myosin releases stored energy to contract the muscle. With rhabdomyolysis, there is an influx of calcium in NaCl, and NaCl causes an increase in the water to enter the cell, which throws off the intracellular space. The increase of calcium causes the muscles to be contracted for longer, which consumes a lot of the ATP supply. This causes inflammation, dying of the cells, and muscle content being released into the bloodstream and extracellular space. Now, therapeutic intervention. Mild cases, it can be treated at home by discontinuing medication causing the condition or rehydration. Severe cases, you want rehydration with an IV, removing the cause, monitoring kidney functions, monitoring muscle enzyme levels, and dialysis. The main goal for the treatment is to preserve renal function. With crush injuries, it's best to start with IV hydration before emergency responders remove whatever is causing the crush injury. Saline should be given at a rate of 1.5 liters per hour, and urine output is monitored until myoglobinuria is no longer present. The dialysis treatment for rhabdomyolysis is very time-consuming, but patients will recover most kidney functions.